Good day everyone, I am Maricel Valerian and I am here to discuss about the treatments for mental illness. First, what is mental illness? Mental illness is a health condition involving changes in emotion, thinking, or behavior, or even a combination of these. Mental illness are associated with distress and or problems functioning in social, work, or family activities. The exact cause of most mental illness is not known, but research suggests that a combination of factors, including heredity, biology, psychological trauma, and environmental stress, might be included. Examples of mental illness are schizophrenia, anxiety disorder, eating disorder, bipolar disorder, and even depression. There are two categories of treatment for mental illness. First is somatic treatments. These treatments include drugs, electroconvulsive therapy, and other therapy that stimulate the brain in order to treat the patient's mental illness. Second is the psychotherapeutic treatments. These treatments include psychotherapy, which is individual, group, or family and marital, behavior therapy techniques such as relaxation training or exposure therapy, and lastly, hypnotherapy. Drug therapy. Drug therapy involves the administration of drugs to treat or prevent diseases. These drugs are prescribed by professional psychiatrists. The drug prescribed for every patient depends only on what kind of mental illness they have. A number of psychoactive drugs are highly effective and widely used by psychiatrists and other medical doctors. These drugs are often categorized according to the disorder they have primarily prescribed for. For example, antidepressants are used for treating depression. Next is psychotherapy. By creating an empathic and accepting atmosphere, the therapist often is able to help the person identify the source of the problems and consider alternatives for dealing with them. The emotional awareness and insight that the person gains through psychotherapy often result in a change of attitude and behavior that allows the person to live a fuller and more satisfying life. This kind of therapy, sometimes referred as talk therapy. There are six types of psychotherapy. First is behavioral therapy. It involves a number of interventions that are designed to help the person unlearn maladaptive behavior while learning adaptive behavior. One example of behavioral therapy is exposure therapy, which is often used to treat phobias. Next is cognitive therapy. Cognitive therapy helps people identify distortion in thinking and understanding how these distortions lead to problems in their lives. The premise is that how people feel and behave in determining by how they interpret experiences. Through the identification of the core beliefs and assumption, people learn to think in different ways about their experiences, reducing symptoms and resulting in improvement in behavior and feelings. Third is the interpersonal therapy. Interpersonal therapy was initially conceived as a brief psychological treatment for depression and is designed to improve the quality of a depressed person relationship. Interpersonal therapy focuses on the following. First is unresolved grief. Second is transition in social rules. And lastly is the difficulty communicating with others. The next type of psychotherapy is the psychoanalysis. Psychoanalysis is the oldest form of psychotherapy and was developed by Sigmund Freud in the first part of 20th century. The person typically lies on a couch in a therapist's office 4 or 5 times a week and attempts to say whatever comes in mind, a practice called free association. It focuses on helping the person understand how past patterns of relationship repeat themselves in the present. Understanding of how the past affects the present helps the people develop new and more adaptive ways of functioning in relationship and in work setting. Next is psychodynamic. Psychodynamic psychotherapy is like psychoanalysis. It emphasizes the identification of unconscious patterns in current thoughts, feelings, and behaviors. However, the person is usually sitting instead of lying on a couch and attends only 1 to 3 sessions per week. Last is the supportive psychotherapy. Supportive therapy, which is most commonly used, relies on the empathic and supportive relationship between the person and the therapist. It encourages expressing of feelings and the therapist provides help with the problem solving. The last type of therapy is electroconvulsive therapy. For electroconvulsive therapy, electrodes are placed on the head, and while the person is under anesthesia, a series of electrical shocks are delivered to the brain to induce a brief seizure. This therapy has consistently been shown to be the most effective treatment for severe depression. Many people treated with the electroconvulsive therapy may experience temporary memory loss. This is the end of our discussion. Thank you for watching.